Let's talk a little bit about the practical effect of the health care ruling with Congressman Chris Van Hollen of Maryland, who was on the Ways and Means Committee when the Affordable Care Act was written, now the top Democrat on the Budget Committee. You've seen it from a lot of angles. Let's start with the first thing that happens here in Congress, which is the Republicans who run the House have scheduled a vote on July 11th to repeal what they call Obamacare. What happens on that day, and do they get any Democrats to go along when that happens?
I don't think they get any Democrats. It's an empty political gesture. In fact, if you remember, the very first vote the Republicans had in the House when they took control was to repeal Obamacare. And of course, it went nowhere in the Senate, and this will go nowhere in the Senate again. In fact, now we have a very positive Supreme Court decision in support of the law. So this is pure politics, but I do think people should understand that they're calling for the full repeal of it, which means that families that are keeping their kids on their insurance policies till they're age 26, or seniors who don't have to pay as much on prescription drugs would immediately lose all those benefits on the Republican proposal, and they haven't gotten to the replace part.
But Mitt Romney said immediately, we'll save the part that says you can get insurance if you have pre-existing conditions. We'll save the part that says your kids can stay on your policy till they're 26. Can they save those things?
Well, of course, Mitt Romney knows better, and that's the great irony here, because when Governor Romney passed the law in Massachusetts, he understood that in order to make sure people weren't discriminated against because of pre-existing conditions, you had to get everybody into the pool, into the risk pool. Otherwise, people game the system. And he understood at that time that you don't want to reward the freeloaders and the free riders. And all of a sudden, he's done an about-face on that issue. The only way you deal ultimately with the question of pre-existing conditions is the way Mitt Romney did it in Massachusetts and the way we did it in this law, unless you want to do a Medicare for all type
because
approach.
The pool isn't big enough to allow the insurance companies to cover everybody. That's the argument.
Well, that's right, because if you don't have everybody contributing to the pool, then the reality is people who have pre-existing conditions, they can wait and just join the pool. So
let's talk a little bit about the other part of this ruling, which is a little less politically charged, but in some ways kind of a bigger policy question maybe, which is the court also said that states do not have to participate in the bigger, more robust Medicaid program that the law envisions. They can opt out if they want to. That's a problem because you don't then get the kind of broad, nearly universal coverage that the law envisions. What's the practical effect of that? What will the practical effect be, and what does Congress do to adjust to that?
Well, I don't think at the end of the day states are going to opt out of this, and here's why. Right now, every state participates in the Medicaid program, which of course is a federal-state share. Right now, on average, you have $6 of federal contribution for every $4 of state contribution. That's the average. Under this part of the Medicaid law, the Affordable Care Act, the match is much more generous from the federal government. In fact, for the first 4 years, it's 100%. 100%. So the federal government picks up the entire costs. And after that, beginning about 10 years from now, it goes to $9 of federal money for every $1 of state money. Right. So for a state that's taking $6 of federal money for $4 of state money now, it's hard to say how they tell their people they're not going to take $9.
So why then did you have 26 Republican governors join a suit that said, please overturn this law so we don't have to participate in that Medicaid program?
Well, I think that Republican governors got very engaged in the overall political battle. Of course, their court briefs did not include only this particular piece. But those governors, those Republican governors, have the option of opting out of Medicaid today, where they're getting $6 of federal funds to $4 of state funds. They haven't chosen to do it, so I think they'd have to tell their people why they would turn down $9 in federal funds to $1.
And your prediction is they're not going to do that. They're going to join in if this.
My prediction is if you're a governor of a state, it would be great negligence to deny the people of your state the ability to get affordable health care when the federal government was putting in $9 to every $1 of state money.
Let me ask finally a political question. You ran the Democratic House Campaign Committee for a couple of cycles. You know how these things play out in the country. What's your advice to Democrats running in tough House seats right now about how they should discuss health care in the Affordable Health Care Act?
Well, I think they should talk about the fact that the Affordable Care Act will do two things. Number one, it will make sure that everybody can get insurance and no longer can be denied by health insurance companies because of pre-existing conditions, one. Number two, that when this bill is fully phased in, starting in 2014, it will bring down health care costs because it will finally create these exchanges, supermarkets, where different health plans will have to compete for people's business, very much like the federal employee health benefit plan that members of Congress have. And that will drive down the costs over time. So you get everybody into the risk pool, everybody has to contribute, no freeloaders, because right now, when somebody doesn't get health care, that raises the costs through premiums and taxes on everybody else. So this will help rationalize the system and bring down costs.
But if I'm your hypothetical congressman and I say to you, it's still not popular, Chris, what do you say?
Well, I know what happened at the beginning of this debate. It was demagogued to no end. People said there were going to be death panels. There are no death panels. People said this was a government takeover of health care. The nonpartisan PolitiFact fact checkers said that was the lie of the year in 2010. Then they said it was blatantly unconstitutional. So all of that has been just proven false. What you find is that people like the specific provisions when they hear about them. And where we need to win the debate is on the overall issue. So we need to sweep away all the demagoguery and talk about what this does and means in people's lives, bringing down healthcare costs, providing greater access.
Something tells me we're just starting that part of the conversation, so I hope we can.
We are, and I think that will have a fresh start. And I do think it's worth reminding people why it was that Mitt Romney thought this was a good idea when he was governor of Massachusetts. One, you can finally make sure that people aren't denied coverage because of pre-existing conditions. Two, he recognized that when people contribute nothing to the healthcare system and their own healthcare, it means everybody else pays a lot more. He made the right argument then. Turns out that when President Obama was for it, he decided to be against it.
Thanks for joining us today to talk about it all.